Hey guys, wanted to show you how you could use the iPad card primarily for the telemedicine specialty side for inpatient and also outpatient. So for this iPad card, everyone's going to have a code that they use to first of all unlock the iPad, and then afterwards, the main thing that you'll be utilizing to conduct these telespecialty consults is really one app, which is right here that looks like a bird. You click on that. It launches the app. You'll see the beam icon along with title care. Each department has its own username, and then the password also will be given. After you've entered the password for the first time, it will ask you, do you want to remember it? So make sure to click yes. In this case, we've already remembered it. And to use it again, right here, you could choose right here. And just put in the code again, and it will auto-populate the password. And click login. Alright, so this is the main screen for the app. Here's where you enter a new patient. Here's where you search for a patient. This top right hand corner, when it's green, it tells you it's connected to the device, meaning the peripherals that we would use to conduct the exam. And it comes in a box like this, and this is your main device. This is your otoscope. This is your stethoscope, and this is your tongue depressor. And you also have headphones. So to start now, see here, to start now, what we're going to do is we're going to use an existing, actually let me do this. Yeah. Before we start any of the exams, let me show you how you enter a new patient. So first, click this. Tell us about your patient, add new patient. Just put in some random letters. And then you choose the date of birth for the patient, female, male. The add patient ID, I really recommend using the MRN number that you have in Epic. So this way it's all consistent. I'm just going to put some random stuff in here for right now. Tells you, does this all look okay? Say save. Oh, one of the letters, because I put the and sign in there. That's why. So let me just take that out. We'll choose some random numbers. Okay, so now the patient is entered. Now it's asking me, would you like to continue with this patient? For right now, I'm just going to click no, but otherwise, you would continue with the exam. Alright, so let's say the patient was entered maybe before, and now you want to go ahead and start the telemedicine encounter. So you go ahead and type the patient's first name or last name. It will go through and search and kind of tell, and you go ahead and pick the patient's name from there, and then say select patient. Alright, so now you have two options. The first one is see a clinician online. The other one is examine forward. This is also known as asynchronous visit. So the see clinician online is when you know the physician is going to be either logging on in 2 minutes or they're already waiting to see the patient. That's kind of what we've been doing over the years, where you log in from a point of care side, nurse, RT, CNA, whoever it is, logs into the app, the provider's on the other side, you conduct a physical exam, and then the provider continues with the interview. So that's that part. The examine forward is, let's assume that you've had, someone told you about an inpatient consult that was done for cardiology UID. From a nursing standpoint, you could go ahead and do examine forward, record all the physical exam, which I'll show you, and then you forward it to the cardiology department. So this way, when they actually do the telemedicine, encounter maybe 30 minutes or an hour later, the physical exam's already done, and they just focus on the interview part. This way, from a nursing side, you don't have to wait around by the iPad during the whole interview process and doing the live physical exam. And even on the outpatient side, if you have 2 or 3 patients that are lined up, you could go ahead and get all the exams ready and get everyone in the queue. So it really is efficient. And physicians also like it because we get information beforehand, and we're able to then, while we're reviewing the chart, we're kind of looking at the physical exam and put two and two together. So it's a really good conversation with the patient afterwards. So in this case, let's go ahead and do a See Clinician Online. So here, what you will have is all the different service lines. So if you know it's, for example, infectious disease, you would choose that at times. But in this case, we already have the physician who's online. So it says Dr. Schultz, infectious disease. So you choose him because you know that's who you're going to be seeing. So you go ahead and choose his name. The first thing is visit consent, making sure the patient has given us the consent to do this telemedicine encounter. After that, this is a very basic kind of an intake in terms of chief complaint, HPI side of things, chest pain, abdominal pain, etc. They also have some COVID questions here. You could also type in some comments if you want. Click next. You don't necessarily have to fill this out, by the way. You're able to skip it. When did this start? Last 3 days ago. How severe is your pain, if they had any pain, or you could just skip it and then click submit. Now what it will tell you, it says, thank you, your request was received. Make sure the phone volume is high enough, or in this case iPad volume is high enough. And what is it saying? Oh, it just probably shut off, the device probably shut off, that's why, but don't worry about this, keep waiting. Alright, so right now your visit will start soon. So what we'll do is if for example Dr. Schultz, you don't hear from him, or if it's another provider, you go ahead and page them, letting them know that you are online waiting for the encounter. So, alright, we'll pause there for a bit and I'll let Dr. Schultz know we're ready. Alright, so right now it says the clinician is waiting to join. Let's see, click join. Alright. So now, hi Dr. Schultz.
Hello.
If you want to move your iPad a little bit, or your camera so we can see you. There you go.
Yeah, what I'm going to do is boost it up here.
Let me see, once we get set up, we can start talking here. And this one. Alright, you could hear us okay?
Yes, I'm going to plug these headphones in and make sure you can still hear me, okay?
Yep.
How does that sound?
That sounds good. Okay. Alright, so I'm going to go ahead and start the conversation. Alright, so now we have Dr. Schultz, who has joined the queue, and now he's going to kind of help us from the provider side. And this is for the live exam, like I said, not for the asynchronous exam and forward part. So the first thing we do for any encounter, just like we've done before, we jump right into the physical exam. The great thing about here is, and we'll walk you through it, is the physician obviously knows what physical exam they're interested in, so they'll kind of walk the point of care staff members through it. So Dr. Schultz, you want to just let us know what you want, and we'll go from there.
Yeah, why don't we start off with a temperature check. I am infectious disease after all.
Yeah, so for this device, right now it says the title device is controlled by the clinician. So nothing that you necessarily have to do, everything that we want to be done, Dr. Schultz will go ahead and click on his side what he wants, and then it will show up here. So now it says, Fahrenheit, put it up here, and then you may have to go ahead and click start on your side maybe.
Counting down, and we have a temperature.
Good.
And it's normal.
Perfect. All right. So that's the temperature. And next, do we want to do skin while we're at it?
Yeah, let's do that.
Okay. So let's say there's a diabetic foot ulcer or something that we want to see. In this case, obviously, I don't have much to show besides my moles or something. I don't know. All right. So here you go. And Dr. Schultz could take a picture on his side once it looks okay. And that's done. You hear the click, by the way, So now what we could do is move forward to the auscultation part.
do lungs next.
So we're going to do lungs, and it's really intuitive. It's going to tell you what to do, right? Which is saying this is a device, and this is the stethoscope attachment. There's a blue dot on here. There's a blue dot up here. Blue and blue go together. So we did this. Now, it pretty much tells us where Dr. Scholes wants us to, put in terms of location. Now, usually you want to go at least T-shirt or, direct to skin. I think the sweatshirt is a little bit too much, but anyways. So Dr. Scholes wants us to listen at number 1. So that's 1.
Good.
And then if he changes the number, it will show up on here. Number 2. So from a nursing side, if it's a student or whoever, it really tells them where they need to auscultate, right? So this is the right and left lungs, but in the front side, but there's also a back side, I want to say. I think there's a switch side thing for you. Choose a different one? I think you chose the temperature.
I had to just toggle off there so you could, so I could hear your audio. It was tough with the.
Oh, sorry. Yeah,
there we go.
I wanted to show them how to do the back auscultation for the lungs too.
Oh yeah.
Yeah.
I can switch back over to it and then.
And then we'll do cardiac.
Okay.
All right. Alright, so this is the front auscultation. Now we're to the back auscultation, same thing, where Dr. Scholes wants us to auscultate. Like I said, go directly to the skin, and then as the physician moves the number, then the staff member goes to the other number, and that's how you kind of just, you follow the physical exam side of things, right? So you do all four, for example, there, move around, and that's your lung exam. So we'll go ahead and move to the heart now. So same thing, it tells you like aortic, pulmonic, but in this case, number 1, number 2. So once again, if you have a student or someone who's not, from a healthcare setting, but is helping or is just interning, they could still help with these exams. And then we move to the next one. So same thing, we do all 4 over there. And then the other one we could try is the pulse, if you want to try. I think it's just the heart with the EKG tracing. So this is for the pulse, which I don't know if it's going to work here, but we'll try. You pretty much put in the middle, and you may have to start a timer. I got 67. Did you get anything?
I got the heart sounds and I got a recording in the heart rate.
Okay, good. So we got 67, and for the pulse, it's about 20 seconds that you kind of have to put there, and it recognizes truly kind of your average pulse. Okay, so you just have to wait a little bit. Usually it's not needed in the hospital setting because you guys already have bedside pulse, if it's along with pulse ox, etc. All right, next, what would you like to move to? Oropharynx?
Yeah.
All right. So although we don't expect for the staff to use it this much, but if we needed to and just give an oropharynx exam.
All right. take pictures. Got it.
Yep. And I think that's pretty much about it. From the device side, there's a tongue depressor attachment for the oropharynx if needed. And we could shut off the camera here on the device. But you could put the tongue depressor attachment, and then there's a tongue depressor separate thing that you put on because that has to be washable. Once again, I don't expect you guys to use it. This is more for pediatrics, really. And sometimes for pulmonary, for the airway side of things. But that really is it for physical exam. And then after this is done, Dr. Schultz will continue with the conversation with the patient. And once that's all completed, he's able to log off and end the visit on his side. We're able to do the same on our side, and that's it. Any questions? Are you good on your side, Dr. Schultz?
Awesome.
Okay, well, thanks a lot.
Thanks, guys.
All right, so clinician completed the visit. Okay, and that's it. All right, guys, so now I wanted to show you the asynchronous exam, the examine forward. Go ahead and choose the patient. Okay, and then we choose examine forward. And remember, the examine forward, aka asynchronous visit. So for example, let's say we order maybe an e-consult, or if the telemedicine visit isn't going to happen till later, and nursing staff is busy and they need to get through things, you are able to go ahead. You already selected the patient, you clicked examine forward, you could do the whole physical exam so the provider has the information, right? So you're trying to give as much as possible to the provider beforehand. So let's choose that. The chief complaint, HPI side of things, the same as your live exam, also has some COVID questions and the free text that you're able to put in. When did this start? And if any pain. And once again, like I said, you're able to skip these if you don't want to fill them in. And then it just goes directly to the exam, right? So this will really walk you through it. Now, instead of the live exam, you're the one here that controls this, right? So you decide what you want. So here, you scroll back and forth, and that's how you see all the exams. So on the left-hand side right now, at least, you have the heart rate. Usually on the hospital setting, you won't use this as much because you already have the pulse from your screen or bedside. You have the skin exam, the temperature, auscultation for the heart, lungs, oropharynx, ears, and general auscultation belly, right? So let's just go ahead and we'll jump onto, instead of doing the heart rate, I'll jump onto whatever we could do without any attachments, right? So it has no attachments right now. So we'll go ahead and do the skin. It is a little bit awkward to hold it sometimes, and it takes a while to get used to a little bit, but let's say you choose the image you want to take. I should probably do it this way. Choose the image you want to take, and then click. You hear the click, done. All right, and it shows you a check mark next to it. Now we'll do temperature. Click that, and this will walk you through it. So it tells you 0 to 2 centimeters, and then there's a start button. 0 to 2 inches, I'm sorry. Put it there. Okay, and that's it. Now we could go to the auscultation part. So it'll tell you what to do. Connect the stethoscope. Blue dot here, blue dot here. Okay. Now, given that you're doing the exam, on the live clinician side, they were listening. In this case, you will be listening. So put on your headphones. In this case, I won't necessarily put them on right now. And then where you plug them in, let me just show you, I'm sorry. So here, this is the front. On the bottom, when you open this up, is the headphone one right all the way to the left. So that goes in there, and the exam starts. So remember, you're forwarding this to the provider. So what you want to do is choose aortic, for example, first, and then auscultate. What this is going to tell the provider is you chose aortic, and whatever they're listening to afterwards is the aortic sound, right? That in that region. Now you choose pulmonic, and you move over, right? Same thing. So now they know what they're listening to. They're listening to this region right there, and you'll do that pretty much for all four spaces. Choose mitral, and you have the mitral kind of highlighted there, and you click done. Alright, so as you can tell, temperature is done, skin is done, heart is done, and now we'll just jump on to lungs. So by default, you have the front auscultation, because a lot of times our geriatric patient especially, it's hard for them to sit up sometimes. But you could go ahead and click on switch side right here, and now you have the back. And let's say you have the back. In my case, I'll just go back to the front here, but then I'll choose right upper. So now you know what you're auscultating. Same thing as the heart. You choose the section, you auscultate the section, right? Left upper, obviously deep breath in and out, and like I said, go to at least try to go directly to the skin versus obviously sweatshirt. And the maximum I would say would just use maybe a t-shirt, but that's about it, right? And you could click done once everything is auscultated. And let's say you wanted to do the belly. The last one just says audio because that's general. You could use that for any abdominal auscultation. So there's no necessary place. You just go ahead and auscultate, right? And kind of let them know. And once you're done, you're done. So that's also being recorded. Now, I don't expect med-surg ICU nurses a lot of times doing like the oropharynx or the ears. But if you do need to do the oropharynx, pretty straightforward. So what you would do is go ahead and choose the throat right there. It's going to tell you remove the stethoscope. Okay. And then you just go ahead and record. And that's it. And if you were to do the otoscope, what ends up happening is you choose the ear, it's going to tell you, plug in the otoscope. Same thing, blue dot goes here. And then now it's going to ask you right or left ear. And there's another sleeve, by the way, that goes on top, right, from a hygiene perspective. And then you just a view in each ear, and then once you're done, you go ahead and click done. Okay, obviously I'm not going to do that here right now, but you get the point. So once all of that is done, right here you click submit all. Okay, so that's submitting. But let's say you have additional information that you want to put in, like blood pressure, pulse ox, glucose, etc. You're able to do that by, I probably should walk you through here a little bit. So on this exam, you have a list of all the exams. On the left-hand side on the top, it says add external data. We click that. Now you have blood pressure, weight, blood oxygen, blood glucose, labs, etc. For our case, I think a lot of times you're probably going to use blood pressure and blood oxygen, maybe glucose and weight. But you could just, for example, for O2, let's say you put 87%, done. We'll also add blood pressure. Okay. Now, all of this is kind of, this is your whole physical exam dashboard, and then you click continue. It's saying uploading exam, send to clinician or see a clinician online. In this case, we're going to send it to the clinician. Send to clinician. Making sure the patient has given you the consent. Confirm. And then you choose. Obviously, there's going to be different service lines. There's individual providers. Who do you want to send it to? So if there's an infectious disease service line that you want to send it to everyone, you do that. In this case, we'll just go ahead and send it to Dr. Schultz. And that's it. And once you're done with this, you could just double click on the iPad button. I guess it depends what iPad button you have, but you just go ahead and close it out. That's about it. All right. Thank you guys. Hope you find that useful.